Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about leaky gut supplements. Do they actually work? And the answer is yes and no. So let's get into the facts. Those patients who come in and they had a mild traumatic brain injury or concussion may not respond to supplementation. So oftentimes we get patients, they've had 2 or 3 concussions, they have a lot of GI issues, and they come in and they are on 10 or 20 different supplements to help with their gut function. But they're not getting better because they have a brain-based issue related to how the gut functions. If you have something called POTS, right? Postural orthostatic tachycardic syndrome, where you have heart rate variability, sometimes concussions can also create POTS, but those patients may have issues with GI function. If you have underlying parasites or GI infection, supplementation may not work also. Loss of oral tolerance. This is when someone is on a very restrictive diet for long periods of time and they can no longer tolerate new foods. So they end up eating 7 to 10 foods that they can tolerate and they never reintroduce other foods. When they do, they have an immune reaction. That is loss of oral tolerance, right? It's a heightened immune reaction. Also, if you're not willing to change your diet, sometimes the supplementation will not work. So it's important to change the diet. So these underlying mechanisms or factors can inhibit someone from healing from intestinal permeability or dysbiosis or quote-unquote leaky gut. So first step, reduce foods that cause inflammation. The most common ones are gluten and dairy. If you can eliminate those 2, you're already on a better footing and you should start to heal more naturally. Next is lectins, nightshades, and soy, followed by food coloring, additives, and processed foods. So if you can eliminate these types of foods, sometimes that alone can springboard you into healing your leaky gut, right, without any supplementation. Also, reducing stress. It's very important. Improving sleep. Number 3, vegetable mash. So what a vegetable mash is, you take maybe 5 or 6 different varieties of vegetables that you typically would not eat. You cut them in small pieces, and you can put them in the refrigerator or freezer. And what you do is you blend it. Not juice it, but blend it like a veggie mash, right? And then you can start with small amounts, even a tablespoon per day, and you work your way up to maybe a full cup. But you can use a vegetable mash to diversify your gut, meaning your diverse fibers from the vegetables will help improve the bacterial levels or the good bacterial levels in your gut. And also, it will increase butyrate. Butyrate is the fuel for your colonocytes. It helps the healing process. So a vegetable mash is a very good one to do. Sometimes just these 3 things alone can help you lead your way out of a leaky gut syndrome. Okay? So let's get right into the supplements. So do they work? Yes, for a lot of people it does, right? It really depends on the underlying mechanisms and what you are willing to do in terms of dietary changes, sleep habits, stress level, and so forth. L-glutamine, a great one. Deglycyrrhizinated licorice, aloe vera, slippery elm, marshmallow root. These usually come in like a package or a powder, right? So you can use 1 scoop 2 times a day of powders that can help the healing process of your leaky gut. You can use digestive enzyme, HCl, plus digestive enzymes to help break down the proteins in your fats and carbohydrates before it hits your small intestine and large intestine, right? So digestive enzymes are very important for that. Zinc carnosine is also great for gut healing, and butyrate. And we talked about how vegetable mash can increase butyrate, but you can actually take supplementation for butyrate, acetate, and propionate, which are fuel for the colonocytes. Glutathione is also a good one. And if I had to pick one probiotic, it would be Saccharomyces Boulardii. The reason is it helps to inoculate the gut. It's resistant to antibiotic residues. I often give it to patients who are taking antibiotics just to replenish the gut. So Saccharomyces Boulardii is a really good one if you had to pick one probiotic. Now there are others, but that's the one I would pick. Now, you can also use fiber. If you have inflammation in your gut, you can use curcumin. If you have histamine reactions related to food, right, or what we call histamine intolerance, or sometimes more advanced would be mast cell activation syndrome, you can use quercetin and DAO with food to help minimize the histamine release in our body. Also, if you have a parasite, you need to use an antimicrobial, right? Parasites, you can use, I guess, a drug or a medication to do that. In our office, we like to use natural herbs to help knock down infection. Things like H. pylori, you can use mastic gum. There's other herbs like oregano and garlic that can affect other small parasites in our system. So it's important to understand the mechanism of why you might have leaky gut, eliminating some of the food triggers, and then if you have a brain-based mechanism, these supplements may not work for you, right? Oftentimes I do get patients with 10 to 15 supplements and it's doing nothing for their gut. So you have to understand if you have POTS or concussions or post-traumatic stress or a brain-based related issue, that these supplements may not work for you. It may be helpful, but it may not fix the underlying mechanisms. So I'll go ahead and link some of the supplements down below in the description. But what I'll also do is I made videos on many of these supplements. So what I'll do is I'll link those videos for you so you can watch them at your leisure. All right. So my name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Awesome day.